Here we have two radiographs on an older patient who sustained a fall and came to the emergency room with shoulder pain. We can see on this AP projection of the right shoulder that the glenohumeral alignment is abnormal. In fact, there's a dislocation of the glenohumeral joint. We see that the humeral head is projecting inferior to the glenoid here. There are these additional bony fragments located here and here, consistent with fragmentation of the humeral head with the donor site here. The glenoid itself looks relatively intact. The majority of the humeral articular surface itself looks intact, and we do not see a fracture across the neck of the humerus itself. In this example, a Y view is very helpful because the patient cannot typically do an axillary view. It would probably be a bad idea to do that. Here on the Y view, we see the typical Y of the scapula and the glenoid depicted here. The humeral head is anterior and inferior to the glenoid, so that's an antero-inferior dislocation. Going back to the first image, our job as radiologists is to identify and characterize the abnormalities, mainly involving the glenohumeral joint in this case, but clearly there's been trauma, so look carefully at the remainder of the scapula, the clavicle, AC joint, adjacent ribs, and probably most importantly look for a possible pneumothorax, which we don't see in this case. Thank you.